me ask you all, what do you think the optic nerve head appearance of this patient would be? I'm pretty sure it should be normal. Even if you show me that report and ask me, I would say it is normal. So a message can be sent to the panel, or if you think it is otherwise. So next slide. Here we go. So is this a normal disc? How many of you think this is a normal disc? If yes, they can discuss with me later. If no, obviously, for me, it is definitely not a normal disc because yes, I see a couple of responses. So what all to look for? I'm not going to comment on what it is, but I'll just go take you through what all to look for. So the disc size, starting with the disc size, which appeared to be big, because there is no comparison. I cannot say definitely, but it appeared to be big. And however, that is a subjective comment. A cup disc ratio, which for me it appeared to be about 8.5:1. And blood vessels, look at the course of the blood vessels, especially inferiorly. They're just tracing out from the margin. Okay. And retinal nerve fiber layer, obviously retinal, this is not a good picture to comment about retinal nerve fiber layer, but still there is a definite absence of neuroretinal rim in the inferior sector of the disc. So this ideally should come up with a correlating visual field defect in the superior arcuate region, but that's not what we see here. This is the fields of the same patient, which shows practically normal field. So now let's look into the advantages of having technologically advanced imaging equipment. Now we have an OCT, which definitely shows a good, beautiful retinal nerve fiber layer defect inferiorly in the RNFL thickness map, which where you can see that there is no color pattern maintained in the thickness map. And if you see the retinal nerve fiber layer RNFL quadrants, each of those 4 quadrants, inferior and the temporal quadrants are completely thinned out. And the same thing is seen in the clock hour wise thickness as well. There's a significant thinning in the clock hour wise thickness and also in the RNFL deviation map. So in this situation, what I would like to say is your clinical skills should only complement with the available technology. Okay, so it shouldn't be like your clinical skills should not be completely dependent on the OCT. Once you see OCT, definitely, don't just go with whatever OCT says, because sometimes OCT or the fields might give you an unreliable result as well. So ultimately, both of these, your clinical skills and the other information should work hand in hand, should be complement to each other. Now we'll consider another scenario where we have a beautiful OCT report. So in this, as we can see this OCT report, and this is also not from my list of patients, and this is taken from the literature, and it is cited as below. So the OCT, which shows normal values all over, and when I say normal values all over, you can see all green, all the quadrant wise 4 quadrants and the clock hour quadrants, also the GCC, and also the final result of the entire OCT showing within normal limits in both eyes. So when your clinical skills, when you're not really good at clinical skills and dependent only on OCT, looking at this, you can just say that you can send off your patient by saying that it's all normal. But let's see what clinical examination looks like. So how many of you all think that this correlates or this goes well with that OCT report? Okay, so I'm sure most of you don't agree with that. So clinical examination or a red-free fundus photograph, which you can see on the screen, of the same patient left eye showing an inferior retinal nerve fiber layer damage. So you see a dark wedge-shaped defect starting from the disc, going in the inferior arcuate region, a shadow kind of a thing. So that's inferior retinal nerve fiber layer bundle, which you can see as a wedge-shaped defect, wedge-shaped shadow. So the bottom line is that irrespective of all the fancy toys or the imaging equipment that you have, your experience or the clinical observation skills and your thought process that goes into the decision making of saying that this patient has glaucoma is all that matters. And never rely only on the computer generated reports, or when in doubt, never rely only on your clinical skills. When in doubt, take a second opinion. Make sure that these equipments are used as something which helps you to 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 provide a second opinion or further detailed understanding of the structure function.